programme. So our focus is around delivery of optimal care for patients with respiratory disease, including those with asthma. I'm also the Children and Young People's Asthma Lead for the ICB, so another of my focuses is making sure that this is a whole of life pathway and that children are safe wherever they are. Looking into the different devices, the bed pump device suited what I wanted really, so I wanted something that had a really good approval process. I wanted to make sure that it was going to be something that would be reliable in testing. I wanted something that was easy for patients to use, but also easy to teach to healthcare professionals. It's tricky when things take a long time. The cost always comes into it. I think cost awareness is something we need to be really careful with within the NHS. And then the other thing was something that was sustainable, that would offer a sustainable service for a long time. We're very lucky in Gloucestershire in that every practice has a FeNO device within their practice. So I know that patients have access to it at the point of care. We are currently using the FeNO device and paying practices to test for diagnostic reasons, but also I know that a lot of the nurses are using it for some monitoring and some education as well. So instead of just focusing on the diagnosis, we're looking a little bit more broadly than that. As part of our local enhanced service, so our payment system, we monitor the number of tests that are being done, and we monitor the number specifically of diagnostic tests. So I know that across our whole ICB, which I think is 64 practices now, around 635,000 patients in total, we're doing approximately 200 tests per week. So there is a bit depending on seasons, depending on holidays and things. I know that we usually do between 170 a week and about 240, so averaging 200, 210. There are so many stories that you could tell of where this has made a difference to patients' care. So I remember one gentleman that came to me that had asthma quite a long time, most of his life in fact, that was something we often see in asthma, in that he was a patient that used his inhalers as and when he fancied and had really poor inhaler technique, and as a result had really poor control of his asthma. And he really felt he was doing the right thing. So we went through the process of explaining what asthma is, explaining how the inhalers work, explaining about the inflammatory nature, and then we used FeNO to measure and demonstrate to him. And he was really shocked that even though he thought his asthma was well controlled, it wasn't. He was receptive to me helping him to use his inhalers with better technique and to using them more regularly. Came back and saw me 4 weeks later and felt like a whole new man, which was fantastic. And his FeNO dropped considerably. So it's quite an easy intervention to get really good control of asthma symptoms. The thing I like about this device is the ease of use, really. I think the fact that it's really portable, so if you've got it in a practice setting, you can move it around from A to B really simply, but it is really easy to use. And I think in my experience, I've had patients as young as 5 able to do the tests, and then patients as old as 95 that can do the tests. So I think it's an all-age, easy to use device. It doesn't take long either. You can do it really quickly within a consultation. I always think a diagnosis of asthma is a bit like a jigsaw. So we take the history, we examine the patient, we look back at the notes for all of the clues that will give us an idea that we're looking for asthma. But then I think it's that confirmation that actually what we thought was wrong with the patient probably is. And looking at spirometry, looking at peak flow that measures lung function, it's not measuring the core component. The core component of asthma is inflammation. So to measure that inflammatory pathway is absolutely that missing part of the jigsaw. And I think it's actually very hard to do that without having that piece of information. So to make a diagnosis without having that piece of information is really tricky. I think it's vital in that diagnostic pathway. It's the missing part of the jigsaw. The device is really simple to use. With coaching, with a little bit of instruction, very few patients fail every time. So having explained the procedure, sometimes patients do the first blow and it's not quite right, but it's easy to coach them to do it properly. And I've had patients from as young as 5, right the way through all ages that can do it. Very occasionally, there'll be somebody that just can't. But actually that's often an indication the patient's got something like breathing pattern disorder, so it's often the breath control thing. So it's even when they can't do it, it's a useful clue.